Hi, Don here. Welcome to Podiatry Practice Mastery. I'm trying to help you get your practice to the $1 million mark and beyond. And today I want to talk a little bit about something that's different, something that's a little personal, a little kind of awkward in some sense. What I feel like, and everyone has their own opinion about this, but what I see and where I was trained is we're all trained to be these wonderful, great surgeons. And recently I went to a conference, and everyone that was the vendors, they were all pretty much surgical vendors. And I didn't have much to talk to them about because I don't do that much surgery. And you might think, oh my, but you were trained, we do this 3-year residency and we come out. But I'm just purely talking in terms of how to get your practice to the $1 million mark. So if you can show me how doing a lot of surgery will help you get there faster, please email me and let me know how that's working for you. What I find is that when I'm at the hospital, I maybe do 3 or 4 cases, and I'm there all day. Maybe if you're at a surgical center, it's a little bit more efficient than the rest of the day. It's hard to do anything. The one doctor I talk to that does it really efficiently locally, he does a case before his day begins. So he just does one case at the surgery center, and then he goes to the clinic. Like that. That's pretty efficient for doing that. But for the most part, I find that I feel uncomfortable saying this, but I don't find that surgery really brings in that much revenue. It's something that I agree that we have to do, or someone has to do that. Now, at the conference, I was there, and they're trying to tell me about the next screw set or something like that, and I said, well, I don't do much surgery. And when I say that, they don't have anything to say, and this might go totally against what everyone else is saying, because there's some talk, or a lot of talk. Most of this conference was actually about MIS, and I know there's some other practice management people that say you have to do tons of MIS for revenue, but I think you can pretty easily get to the $1 million mark without that much surgery, and that's kind of what I pride on showing people. So I'm going to tell you today how I get out of doing surgery. I know it sounds funny, but if you want to get out of doing surgery, you have to have who that can do the surgery for you. So in my practice, there are a couple of others that like to do surgery. There's a younger doctor that just finished residency, so he needs his numbers. There's another doctor that just does a lot more rear foot, but the problem is he doesn't even like doing it as much anymore, because he realizes when it comes down to numbers, it's not that profitable, and that's kind of one of the struggles for him, because he has all the post-op care and kind of the time that it takes, and he's trying to do less surgery, but unfortunately sometimes surgery is needed. So what do I do? So I have a couple of people I can refer to. I want to give you a couple of examples, and don't take me wrong, but this might be for some of you that don't want to do as much surgery. My surgical dates, I usually have surgery maybe every 2 to 3 months. So maybe I have, let's say, 5 or 4 dates a year. That's all I do. I don't do it weekly. Maybe every month, maybe every other month. And so because of that, I'm not that available. So I had a patient come in the other day. He needed a bunionectomy and a hammer toe. And do I do that? Yes, I do that. If you've heard some of the things I've talked about before, I have a list of surgeries that I do. I know this sounds kind of rudimentary, but I have a list of those that I feel confident doing. I think there's a difference between doing surgeries and being confident doing them. And this was on that list. So it would have been an Austin bunionectomy with a hammer toe repair. Certainly, I can do that. But if you think about it in terms of revenue standpoint, it wasn't the best option, and we have this other young doctor. So she was a teacher, and she wanted surgery around Christmas time, and unfortunately, my Christmas block, which is December block that I have, is already filled up. So I said, I can certainly do that, but it'll take about 6 months, or I have this wonderful other doctor that can do this for you. And he is excellent, and I trained him, and this and that. So I really lift up these other doctors that are in the practice before they go see them, and they get great results. So this is kind of the way I'm doing it for the surgical. There's also another doctor. He was actually a doctor that needed surgery. He had a kind of a difficult foot issue, and a type of surgery that I don't do a lot of. So he had kind of some osteomyelitis, needed the osteo removed. I don't do a lot of diabetic care and osteo. And so I referred this to another doctor, just saying that I don't do it a lot, because those are things I don't want to lose sleep over. And so that is what I'm doing now in terms of, once again, it's block time. So let's say you have a surgical block time. They might give you once a month. You could actually just ask, so I only want, instead of once a month, you could ask for every 2 months. I know that sounds odd, but instead of more time, you could ask for less time, or you could give it to my partners. That's what I've kind of done. So my partners kind of use that time. And in the beginning, I was a little upset. What happened is at the beginning, I'm like, I had to do this thing, and I didn't have time to do it. But now it's actually turned into a plus for me. So now I can send it over to them, and they can do it, and then I can kind of see the patients that provide more profit. So this is all focused on getting your practice, once again, to the $1 million mark. And if you feel like, hey, this, surgery is the thing, and it can get me there, and yeah, maybe like a out-of-network cash pay type of thing, that might work for you. But I think there are other ways of getting to the $1 million mark than doing surgery. So I know this might resonate with certain people. Let me know. Send me an email, don@podiatrypracticemastery.com. Love to hear from you. And if you're interested, there's some things on that website that might benefit your practice.